I have a patient that we've been monitoring for the past 2 hours. He is a post-op cabbage male, has no history of any lung disease. We did weaning test on him earlier. He passed all the weaning tests. He passed the shallow breathing test. We're going to do a positive leak test to make sure he passes it. Since he passed all the tests, the doctor has ordered for him to be extubated. His lab work come back good. He had a good ABG, so we're going to explain to him and we're going to extubate. Before I go in there, I got equipment that I need to take. I'm going to take my airbag box and my blade just in case we have to re-intubate. I'm going to make sure we have an ambu bag and the right fitted mask in case we need it and have to ventilate him, oxygenate him. Then I'm going to have my 10 ml syringe, that's to deflate the cup. I'm going to have my yonker, and I'm going to have a suction catheter, which is already in the room. Then I'm going to have my O2 source, which is a nasal canyon with a humidifier. The humidifier is to make sure his nasals don't dry out. And the reason that I'm going to have a nasal canyon, I'm going to put it on 5 liters because while he was on pressure support, CPAP, he was on 40%. And we want to match that just to make sure his stats don't go down and they stay up where they need to be. Okay, I'm going to enter the room. Hi, I'm Christy from Respiratory. We're here to extubate you. Your doctor has looked over your orders and the weaning test that we give you 2 hours ago, you passed all of them, done good. So he decided that we can extubate you. Before we do that, I want to go over some stuff and wash my hands. I want to identify who you are, so I'm going to look at the name, wristband, date of birth, medical ID number, anything that identifies him. I'm going to explain these procedures to you. It might be some risk to extubate you. You might have a little bit of swelling in your throat. You could aspirate, but we're going to suction to make sure that doesn't happen. We just want to make sure you might have sore throat, but that won't last long. So I want to ask the family, make sure they understand what we're doing, and they understand. So before I do it, I'm going to do a leak test on you. I'm going to check your vital signs, and so far your vital signs look really good. Your stats good, it's up there where it needs to be. I'm going to listen to the breath sounds, which is 4 in the front, 4 in the back, and 2 in the side. And they sound really good. So I'm going to get a towel. I'm going to get ready to extubate you. I'm going to hook up your O2 to make sure that's ready so we can have it to put on you. I'm going to go ahead and put it on 5 liters to make sure all that's ready because we want to put that on him right after we extubate. I'm going to have it ready right here. Have the yonker for the suctioning. Have that ready. Not going to go yet. Going to turn it on. It's negative 80 to negative 120. Going to make sure it works. And it's going up to 120. I'm going to have that ready. I'm going to have the ambu bag ready just in case, and we always want it hooked up to 100% oxygen. I'm going to have that ready, hooked up. There'll be an extra source of oxygen here to have your ambu bag. My syringe, which deflates the cuff. I'm going to have it ready. Okay, and I got the towel down. Okay, before we do this, I'm going to listen to the leak test, and what I'm going to do is I'm going to ask you to take a deep breath in, and then I'm going to ask you to cough, and when you cough, I'm going to pull the tube out, and then I'm going to suction around your mouth. So what I'm going to do now is I'm going to suction the patient, put it on 100% O2 while I suction. Okay, I'm going to suction. It's a little uncomfortable. Alright, it looks good. I'm going to suction the inside around. Just make sure there's nothing back there. We don't want you to aspirate or anything. Alright, that's good. Okay. I'm going to do the positive leak test, which I'll deflate the cuff, and I'm going to listen. And everything sounds good, you just don't want where you couldn't hear no leak because his throat will be swollen, which will cause problems for him to breathe after we take the tube out, and we might have to intubate again. So all that sounds good, it's deflated. All right. So now what I'm gonna do is have you to take a deep breath in. We'll put the ventilator on standby. I'm gonna unhook it. Take a deep breath in for me and cough. All right. Let me suction. We just make sure nothing is down in there so you don't be swallowing or aspirating or anything. Okay. I'll go ahead and put the O2 on him because we want to have that hooked up to him as soon as possible. Okay. And I'm going to listen. Get it on. Okay. There you go. Does that feel good? All right. I'm going to listen to make sure his breath sound good. Can you tell me your name? All right. And we do that because we want to make sure your vocal cords is good and that you can speak and everything. All right. I'm going to put the pulse ox on him because he's not hooked up to the monitor anymore to measure his sat. So I'm going to put pulse ox so we can measure that. His breath sounds really good. His vitals look good. His color's looking good. His stats are really good. They end up 98. They look good. Okay, so you've done really good. I'm going to stay here and watch you just for a few minutes, and then I'm going to keep coming back and checking on you to make sure you're doing all right. I'm going to leave the ventilator in here, turn it off and leave it in here for 24 hours just in case he might need it again. I'm going to take all the equipment and we're going to throw it in the trash, dispose of it. And then I'm going to wash my hands and chart.